Good morning, friends, and I wish you a happy Republic Day. So, with the quote by the Alexander Fleming, penicillin started as a chance observation. My only merit is that I did not neglect the observation. Okay. So, Alexander Fleming was a Scottish scientist. He was also a microbiologist. Okay, so he was a microbiologist and a Scottish scientist. So he was actively working on antibacterial substances which could be toxic, which could not, which should not be toxic, which should not be toxic to the animal tissues. And in 1921, he discovered lysozyme. Okay, in 1921, he discovered lysozyme, which is a very important bacteriolytic substance. So it is a bacteriolytic substance. Okay, it is a very important bacteriolytic substance in the human body. Okay, in 1928. Okay, in 1928. So while working, he was working on influenza. Okay, in 1928, he was working on a influenza virus in his lab. He was also working on a staphylococcus culture. Staphylococcus culture. So in 1928, he was also working on influenza as well as Staphylococcus aureus culture. So, meanwhile, he went for a vacation, but before his vacation, he forgot to keep a petri dish of Staphylococcus inside the incubator. Okay, during that time, a group of mold spores, okay, a group of mold spores, okay, a group of mold spores were served with the breeze and entered his lab and drifted into the same petri dish which he left outside and they landed in the petri dish and they started germinating, and then a medical revolution has started. Okay, in 28th September 1928. Okay, so this mold has drifted and landed in the petri dish where Staphylococcus aureus culture were maintained, and then a medical revolution has started. When the Fleming came back from his vacation, he observed that mold had developed accidentally in the culture, and mold had created a bacteria-free zone around them. Okay, so mold has created this area. Suppose here is the mold. So in this whole area, in nearby that area, there were no bacterial colonies. Okay, there were no bacterial colonies. Later, he found mold culture prevented the bacterial growth of Staphylococcus even when diluted 800 times. Okay, 800 times he diluted the mold culture. Okay, and then he found that even that time also the bacterial culture like Staphylococcus bacterial growth was inhibited. He named it active substance as penicillin. He named this active substance as penicillin. Then, for the next 1 decade, there were no development in the penicillin purification and isolation, and it remained a laboratory curiosity until Howard Florey. Okay, until Howard Florey. This scientist is very important. Howard Florey and his groups. Okay, they found they discovered a method to purify penicillin and to keep it in a stable form in the Oxford University. Okay, Oxford University. What they did, they found a method to purify, okay, to purify and keep the product that is penicillin, in a stable form. In a stable form. Okay, so what they did, they found a method to purify, okay, to purify and keep the product that is penicillin in a stable form. In a stable form. Okay, so what they did, they found a method to purify, okay, to purify and keep the product that is penicillin in a stable form. So this was a great achievement. And in 1940, in 1940s, when England was at war, that is World War II, they needed a mass production of this wonder drug, that is penicillin, and then comes the name Pfizer. Pfizer in 1941, they started the mass production of penicillin from Penicillium chrysogenum. So remember, the first penicillin which was found by the Alexander Fleming was Penicillium notatum, and the penicillin which is used for the commercial purpose was Penicillium chrysogenum. So this was the whole story behind the penicillin. So already I have told you it is discovered by your Alexander Fleming, and the first penicillin was extracted from the Penicillium notatum genus. And for the mass production, the penicillin genus, which was the penicillin species which was used, is Penicillin chrysogenum. Okay, Penicillium chrysogenum. It was the mutated form of the Penicillium notatum. So for this commercial production, they have used this Penicillin chrysogenum. Now, the first penicillin was your Penicillin G. Okay, it is a prototype. Prototype means the first one to be used. Okay, Penicillin G, and it was acid labile. Okay, it is acid labile. Acid labile की meaning क्या होता है? Acid labile means जो acidic environment में वो रह नहीं पाएगा. Okay, so acid labile means they cannot survive in the acidic environment like it is there in our stomach. Okay, so therefore, this penicillin G cannot be taken orally. Okay, note that it cannot be taken orally. Cannot be taken orally because it is a acid labile, so it cannot be taken orally. It should be taken parenterally. Okay, so it is given generally parenterally. Another thing is penicillin G has a narrow spectrum of activity, so it is generally active against the gram positive and few gram negative. Okay, and few gram negative. Since gram negative bacteria has lipopolysaccharide layer over the peptidoglycan, so that penicillin generally can't cross that lipopolysaccharide layer. So that we have already studied during the about the mechanism when we were reading about the mechanism of action of penicillin. Next thing you have to know, natural penicillin is your Penicillin V, okay, also known as phenoxymethyl penicillin, and it is a acid stable. So since it is acid stable, it can be given through orally. It can be given through orally, but it is less potent. It is less potent than the penicillin G. Third class of your penicillin is your beta lactamase resistant penicillin. Okay, beta lactamase resistant penicillin. We already know that beta lactamase is responsible for the resistance against penicillin, and this beta lactamase is secreted by some of the bacteria. So this beta lactamase resistant penicillin will inhibit this beta lactamase enzyme. Inhibit what? This beta lactamase enzyme, and this is often given with other type of penicillin like ampicillin and amoxicillin. Now let's see the spectrum of activity. So penicillin G is generally given for gram-positive cocci and bacilli and some gram-negative cocci. Next is carboxy penicillin like carbonicillin and ticarcillin. Nowadays it's not widely used, but it has some antibacterial activity against Pseudomonas species and Proteus species. Clavulanic acid in tazobactam is a beta-lactamase inhibitor, and it has very little intrinsic activity and often given with other penicillins like amoxicillin and ampicillin. Aminopenicillins like ampicillin and amoxicillin is active against both gram positive and gram negative, and these are especially active against gram negative bacilli, but they are less potent than the penicillin G. The amoxicillin and ampicillin are less potent than the penicillin G against gram positive cocci. This amoxicillin is well absorbed from GIT than ampicillin, so clinically it is more preferred. Okay, and these both drugs are sensitive to beta lactamase because these both drugs are inactivated by the beta lactamase enzyme. Another class of drug is uridopenicillin, that is piperacillin and meglocillin. These are active against Pseudomonas aeruginosa. Pseudomonas aeruginosa. Now let's talk about resistance. So regarding resistance, so some of the bacteria develop resistance by producing beta lactamase enzyme. Okay, this beta lactamase enzyme will hydrolyze the beta lactam ring. So if this is the penicillin structure, this is the rough structure of penicillin. Okay, so this is the beta where they will hydrolyze this ring, this this one. Okay, they will hydrolyze this bond. So in this when this bond is get hydrolyzed, so penicillin get ineffective. Next is methicillin resistance Staphylococcus aureus. Over a period of time, with excessive use of penicillin, some bacteria have developed some peculiar mutation, like they have mutated their penicillin binding protein, and therefore this penicillin, this beta lactam antibiotic, were unable to bind this penicillin binding protein. Okay, so this some of the bacteria has changed. Some of the bacteria have changed their penicillin binding protein structure, and therefore this beta lactam antibiotic were unable to bind into this penicillin binding protein, and therefore ineffective against this type of species, bacterial species. Now let's come to pharmacokinetic. So penicillin are widely distributed in body fluids, joints, pleural and pericardial cavity, bile, saliva, milk, and it can cross the placenta also. Okay, since the penicillin is lipid insoluble, it cannot enter the mammalian cell and blood-brain barrier. Okay, they can only enter the blood-brain barrier during meningitis. Meningitis is the inflammation in the meningeal region. Okay, meningeal region. So when there is a meningitis, that time only this penicillin can cross the blood-brain barrier. So this indicates that whenever there is a meningitis, we can give penicillin for the treatment. Okay. So now elimination of most of the penicillin occurs by kidney and through active secretion, and especially in the proximal tubule. So 90% of the penicillin will be excreted. 90% of penicillin will be will be eliminated through proximal tubule. Okay, by active secretion. When it comes to the adverse effect, it has some GI disturbances like nausea, vomiting, diarrhea, epigastric distress, and around some patients show hypersensitivity reactions such as skin eruption, urticaria, fever, edema, nephritis, anaphylaxis. So around your 5 to 15% of persons shows hypersensitivity reactions to penicillin. Convulsion also may occur at high dose. Okay, convulsion also may occur at high dose. But always remember the therapeutic index of penicillin is very high. Therapeutic index of penicillin is very high. Okay, so that means some the if the dose is differ by some mgs, so it may not affect it may not give any adverse effect. Okay, that means the therapeutic index of the penicillin is very high, means they are more safe. Okay, they are safe They are safe drugs, okay, when compared to others. Next comes to the clinical use, or we can say indication. So benzyl penicillin can be given for the treatment of bacterial meningitis, as it can cross the blood-brain barrier during the meningitis. So it can be given intravenously to treat bacterial meningitis. Fluoxacillin Fluoxacillin can be given for bone and joint infection caused by the Staphylococcus aureus. Benzyl penicillin and fluoxacillin can be given for skin and soft tissue infections generally caused by Streptococcus pyogenes and Streptococcus aureus. Next is penicillin V. It can be given for pharyngitis for S. pyogenes, and amoxicillin can be given for otitis media. This otitis media is commonly caused by S. pyogenes and H. influenzae. Other indications are amoxicillin can be given for bronchitis, pneumonia, and urinary tract infection and gonorrhea. Procaine benzyl penicillin can be given for syphilis. And high dose intravenous benzyl penicillin, sometimes with aminoglycosides, is helpful in endocarditis. And ticarcillin piperacillin can be given for serious infections with Pseudomonas aeruginosa. So some clinical consideration which you have to consider, this clinical consideration which you have to consider before giving penicillin to any patient. So always remember there are around 10 to 15% of individual taking penicillins are allergic to penicillin. Okay. So you should take a history from the patient that whether in the past they have got any allergic reaction to penicillin before prescribing penicillin. And in 0.01% of patient it causes anaphylaxis, which is very lethal, okay, to the person. So always we should take the history of the patient regarding penicillin use. It may also cause cross sensitivity to cephalosporin and carbapenems. So if the patient is having a history of allergy to the any medicine, allergies to penicillin or any other medicine, penicillin or any other medicine structurally related to penicillin, so they should not be prescribed penicillin or cephalosporin or carbapenems because it may cause severe problems like urticaria, anaphylaxis, interstitial nephritis. Okay, so this is contraindicated. These allergies are contraindicated. Past allergies are contraindicated for penicillin, cephalosporin, and carbapenems. If a person is taking prolonged high dose treatment of penicillin beyond 10 days, so their renal and hepatic function should be monitored all the time. Okay, should be monitored all the time because it may cause super infection in that type of person. IV penicillin preparation are often physically incompatible. Okay, so penicillin are generally incompatible with other type of drugs. So in one syringe, you should not, or in one infusion solution, you should not mix penicillin with other medicines. Next is some of the species are resistant to penicillin, and that in that type of species you should not prescribe any penicillin or cephalosporin. Some of the examples of the species which are resistant to penicillin and cephalosporin are Enterobacter, Serratia, Citrobacter, Acinetobacter, Aeromonas, Proteus vulgaris, Proteus spineri, Providencia, Morganilla, morgani. Okay, so these species are resistant to penicillin and cephalosporin, so should not be prescribed in infection caused by this species. The whole material for this uh, presentation was prepared from the following books. Number one is your Rang and Dale's Pharmacology, 7th edition. Number 2, your Shen Bullock and Elizabeth Manias. It is Fundamental of Pharmacology, 7th edition. And D.A. Weller, Pharmacology in Therapeutics. So for more detail, please refer these books. Thank you very much for listening to my lecture. Thank you very much.